Okay, I want to update you just for 15 minutes or so on where we are now with this project, and a little bit about some of the planning that's going on regarding sustainability, how we're going to work with all of you and the partners over the coming months and years, hopefully, to keep things going. And the context, this will be described, I think, much more eloquently than I will by Tony when he talks a bit later. But we're working in this context of bridging that gap, as I said earlier, between worlds of research, worlds of healthcare. This is just becoming an ever more important point on the agenda. This diagram is part of a paper written by Tim Beck, who's sat just down here in Tony's group, the I4 Health initiative in Europe. But again, Tony will refer to that later. But this idea of data as a public good, I think many of us are aware, is not just a nice idea, but it's seen as a necessity, both for economic reasons and also for measures of efficiency and so on. So it's a high strategic priority for government, NHS funders and so on. So we've been developing this idea of software as a service, data management infrastructure, but we've been working with these open source applications, and that's still a relatively new idea in significant parts of the NHS, for example, in the UK. And what we're trying to do is show that it is possible to do this in a sustainable way, and in a way which works with the grain of the clinicians, researchers, clinical nursing staff and so on. And I think what we've already demonstrated is the potential for significant, not just efficiencies, there is the potential for significant IT savings as well if you're able to scale this over a reasonable timescale and across a reasonable number of groups of researchers. And in order to make it work, though, you need to cross this divide and work closely between universities and the NHS, the trusts, and the biomedical research units and centres in particular, funded by the NIHR. So we have this standard diagram. Now, those of you attending the hack over the coming 2 days, I think there's a bit of a culture of prize giving in hack events. And I know that Ollie over there, one of our lead developers, is going to kill me if I don't mention the fact that one of the arrows on this diagram is wrong, okay? There's a misplaced arrow in one place, so special prize from me after 2 days if someone can tell me where that was. I'll have to put these online. But this diagram here is our kind of vision, if you like, and something I think you'll begin to see during the demo is becoming a reality. Essentially of entering patient information through, in this case, the CiviCRM module. So handling patient records and recruitment, building cohorts for studies, have people been previously built into a study elsewhere, and what was the record there. And then feeding that information through the tools that the researchers want to use, whether it's for tissue management, data warehousing, and so on, but doing it in an integratable way that people can plug their own tools into that layer as well. And then, of course, you need the relevant information governance to allow people to access and perform queries on that data, whether on the university or the hospital side of the fence. Right. So I suppose the unique things about BRISSkit that we've been working on are the fact that it's integratable and hopefully in a sustainable way. But that these are mature open source applications. They're already in use standalone within cardiovascular sciences here. And so there's already been significant UK customization. But the point is that in North America, there's significant use of these tools in what is a much less socialized healthcare system. So I think that we can, there are good grounds for growing the use of these tools within the UK, and that we actually are in a strong position to do that, given the fact that we do have national frameworks around the NHS. So obviously in an ideal world this will be as seamless to manage as possible, but certainly configurable over web browsers and usable over web browsers, and that means mobile technology in wards and labs and so on. And of course that hasn't always been the case and often isn't the case at the moment for many of these groups and researchers and clinicians. So what we're trying to do is make it possible that not every group, not every research group has to build their own little server system if they don't need to. Many research groups will still need to do that, of course, because they're still doing research and they're still building their own solutions for things. But what we hopefully are offering is some core functionality which many of these groups need to do, whether it's tissue management or whatever, is possible. You don't have to reinvent all of that for every different new project. Okay, and you don't necessarily have to, if you're a small research group, you don't necessarily have to procure what may be a very expensive solution in one of those areas. So it should be easy to set up, and of course a key thing that came out of the last workshop, I'll come on to this, is the need for information compliance, obviously in the NHS context in particular, and this will be true internationally. So the current position is that we've done this first phase of customization and integration, and that's being used, can be used already in certain areas in the UHL Trust. We had to produce a return on investment report to HEFCE, which informs the sustainability arguments and how do we make this sustainable longer term. But we had the second bid accepted for 6 months to March 2013. At the moment, that was the only bid in that funding stream that's been renewed to date. So I think that we can count that as a success. Obviously, we've now got to build how we sustain things longer term beyond March next year. But I think importantly, the focus in this second phase now is actually implementing with pilot groups, and we've got pilot groups working with us here today who'll say a little bit about the research they're doing and then how they may be able to use one or more of the BRISSkit components to help with that. So we'll be working on the ground with those groups in the coming months now. So this is the sort of community that we're building. Obviously there's the website and wiki that's beginning to, these things grow slowly at first, but beginning to gather some momentum. We're beginning to get a bit more use of that resource. Obviously the contact details are there. But it is important what I've said about the partners that we need to work with to make this happen, and there's sort of a list of a significant number of them there. And we've got Sri here from Krishagni, for example, and others who will help us in the Hack Day. We've got to work with these different partners in order to make this sustainable. And that's the way we view it, that this is a partnership. So who's it for? We think that hopefully you'll see through the demo that this is aimed at a number of different levels. Potentially there is scale to make integrated toolkits available where people can plug into what we provide or what they host that we provide. And that these jigsaw pieces can come together and fit with their own work. But of course it can be used just at the enterprise level as tools over a browser, easily configurable by individual researchers or research groups and departments. So in the first community event we had in January, there was some sort of key feedback that came out, and some of the people who gave that key feedback are here in the room. Cloud provision and data handling has to be to NHS standards. There is a climate of fear still, I think, around the risks around cloud computing. I think more and more people understand that actually the uptime of cloud computing resources, you hear about it when they're down, but they're actually up much more than most local solutions are. But obviously we need to work on that, and we need to make sure that we're compliant with the information governance. And you'll hear a little bit more later about how we're working directly with the UHL Trust here to host BRISSkit components behind the NHS firewall for those groups, and we're happy to talk with external groups about how we can extend that potentially for their use. And we'll be developing that over the coming months. It takes months to get the relevant accreditation required for our toolkit, but those meetings are already ongoing, and we've got a specific lead on that area. There'll be a bit more later. And of course, as I said, we're piloting the toolkit with partners, running demos. So the project funding we have for this second phase is specifically to support those partners as a significant part of that. And obviously we've got the collaboration platforms. We've already given 2 or 3 webinars, and there'll be 1 or 2 more around the different components of BRISSkit. And we'll make those available so that people can replay them and access them whenever they need to. And then obviously there's the IP management, which is an ongoing conversation, and basically making things easier to integrate with their own solutions that have been developed. And we've got this kind of internal engagement plan, if you like. This is a kind of rough timeline for how we'll be developing over this period. We've obviously already set up some of the app education and training through the webinars, and we've been taking the first steps with the pilot groups now to allow them access to versions of the software. You have to try these things often to really know how they may or may not be useful in your context. We'll be showcasing some solutions at the EHI Live event, eHealth Insider, in early November. We'll have a stand there on the Skunkworks open source area. And then obviously we hope to see some interesting solutions being discussed and first bits of work done on them at this Hat Day in the coming 2 days. And then obviously we'll be following up in more detail over the months to follow and providing evaluation and feedback. And we hope to be able to launch some of these things as services from April next year. So just a couple of slides on the business side of things, if you like. We were able to show using some assumptions. A lot of assumptions go into making these kind of calculations, but we were able to show that equivalent of 40 researchers, which could be across 1 BRU, it could be across 2 or 3 in a trust, over 5 years already repays the sort of investment that's been made by HEFCE in BRISSkit. So you would hope, therefore, that if you can scale that, it's quite front-loaded, as they say. If you can scale that more widely across many BRUs, many BRCs, research groups, and so on, I think that provides strong arguments. And if people are interested in more of the detail of that, we're happy to discuss the work that we did on that. So we certainly believe that just within the Leicestershire Trust, take-up across, if we get a reasonable level of take-up by some of the groups across the 3 BRUs, biomedical research units, and their researchers, that is a scalable long-term solution that makes sense even across this trust, and certainly if we scale it more widely. So there are, of course, risks from scaling more widely and nationally, and there's a whole issues of legal structures and governance that will have to be addressed, but which we are studying now. We've presented to business expertise in this university, but I think increasingly asking more widely as well. And I hope discussing with some of you as partners about what might make sense for you in that area too. So I think the 2 major options beyond March at the moment, as we see it, are embedding as a service only within Leicester. That would be the easier thing to do, just making the open source components available for reuse. But we do hope to build a community around this that's sustainable more widely, and we're actively investigating the options on that, and welcome people's input on how they'd like to work with us on that.